So without further ado, I wanted to introduce Helgi Helgason, our Clinical Operations Director here at Fusion Health. And Helgi, I'll let you go ahead and just take it away.
All right, wonderful. Thank you so much. And thank you everyone for joining me today here for this webinar. We're going to be talking about sleep and mental health. And although the first slide does point out, we talk about poor sleep, but I do want to begin by often saying, I want to talk about what good sleep does for us and why we should strive for good quality sleep. It has been shown that we're often asked, how long should we sleep? What is kind of the sweet spot? And 7 to 8 hours has been shown to be the sweet spot as it relates to strongest cognitive functioning. A lot of the things we're going to be talking about today has a lot to do with cognitive functioning. 7 to 8 hours, it should be something that we aim for. What could we gain by putting sleep on our schedule and focusing on 7 to 8 hours of sleep each night? Well, first of all, it has been shown that good quality sleep and 7 to 8 hours enhances memory and it increases creativity. It keeps you slim, and thus lowering food cravings. Makes you look even more attractive sometimes. So this beauty sleep is certainly something that has been talked about, but studies have shown that increased blood flow and cell generation and does have an impact on one's complexion. So, but also, what more importantly, as it relates to our immune system, the good quality sleep wards off colds and flu. It lowers risk of heart attack and stroke and diabetes and other unhappy bedfellows that can accompany poor sleep and sleep disorders. And then lastly, you'll feel happier, less depressed, and less anxious. Well-rested individual is better to cope, better able to cope with the challenges of the day. So focusing on a good quality sleep and 7 to 8 hours certainly has a great deal of benefits. It has been shown, going back to some of the research that a study published in the journal Sleep studied over 10,000 individuals, and if it had been shown that if you had slept more or less than the 7 to 8 hour sweet spot, as we referred to, reasoning and verbal skills were often impacted. So that's certainly something to consider for the workplace and those that are going to school and studying that. Being able to articulate their thoughts, if you are not well rested, these will be some of the things that would be certainly impacted. But of course, unfortunately, there is so much emphasis, and perhaps rightly so, on impaired sleep. So what does poor sleep or inadequate sleep do? Well, as we have an increased risk for high blood pressure. Hypertension is always a concern, and untreated sleep disorders and short sleep has been linked with increased risk for high blood pressure. Diabetes as well. There is a higher risk for diabetes with poor sleep. That, of course, also increases risk for heart diseases and obesity, all of which have a great impact on our quality of life. And then lastly, as we point out there, poor quality sleep increases risk for accidents. Why is there an increased risk for accidents? Well, there is slower reaction times. Individuals that are sleep deprived, whether it is because they sleep too little or their sleep quality is impacted, they will produce what are called microsleeps, where the drive to sleep becomes so much that they will actually zone out. This is one of the things that we see in the most severe motor vehicle accidents. Studies have shown that by keeping individuals awake 17 to 19 hours without sleep, that equates to a blood alcohol content of 0 to 0.05, which would be making the individual legally drunk. And so studies out of the University of Chicago have done this and presented several papers on this, where they allowed, kept healthy individual, healthy students, participants in their research trials awake and then a control group was those were enabled to have some alcohol, and then they were all put into driving simulators. And the group that if they were kept up over 16 hours, 17 to 19 hours, then they started really to show significant deprivation in their abilities on the simulator, and started to drive just as if they'd had a couple of drinks in them. Now, more significantly, of course, according to the National Highway Traffic Safety Administration, driver fatigue is responsible for about 100,000 motor vehicle accidents per year, and then more significantly, 1,500 deaths every year. Sleep deprivation is not only bad for your mind and body, but in some cases can also endanger the lives of others, yours as well as others in the car, and of course the motoring public. A study that tested people using a driving simulator showed that sleep-deprived people, as I was alluding to, drove as badly or worse as someone who is intoxicated. And then on top of that, sleep deprivation also magnifies the effect of alcohol on the body. So a drowsy person who drinks will be even further impaired than a well-rested person who drinks. And of course, we should never drink and drive. Now, what are other risk factors that can occur with poor sleep? Well, as we were talking about the high blood pressure and the increased risk for diabetes, the mechanisms behind that is the arousal mechanism that occurs in sleep following, shall we say, for example, in obstructive sleep apnea, there is an arousal that activates the brain to where the brain kicks in to say it's not getting enough oxygen, it's not getting the amount of or it's working too hard to enable the person to breathe during sleep, or during restless leg syndrome or periodic limb movements in sleep, where there's activation that occurs or an arousal following these leg movements and kicking during sleep. Well, this is the same physiologic response as is called the fight or flight response. And so during this episode, when you have these arousals where the brain activates to end an event, you have this influx of cortisol or stress hormones, and you have this influx of these sugars into the system, which then elevate our blood pressure, elevate our risk for diabetes, since these sugars can throw off our glucose metabolism. And so you have this fight or flight response when we are sleeping. So we should all be resting, but it is as if we have come into a situation that is stressful for us, but there is no physical exertion to go along with that. Obviously, if there's a fight or flight response during our wakefulness, we should be able to run faster, jump higher, and so on. But during sleep, these stress hormones flow through our body and into our blood flow and into our cells, and throw off all these mechanisms that then increase the risk for these unhappy bedfellows, such as high blood pressure and diabetes. Now, how does this then tie into also the risk for mental health? Well, poor sleep and depression are very closely linked. Treating one condition often improves the other. And so given that research suggests that 60 to 90% of patients with depression have insomnia, which is where individuals have a tough time falling asleep, secondly, staying asleep, or they wake up too early. And approximately 20% of those people with depression have sleep apnea. So on top of that, these situations can all compound one another. Looking after our sleep to promote good mental health seems imperative. Now, the Harvard Mental Health Newsletter stated once viewed only as a symptom, sleep problems may actually contribute to psychiatric disorders. So people who sleep poorly are much more likely to develop significant mental illness, including depression and anxiety, than those who sleep well. And I think we'll dive a bit further into the link between these healthy sleep and then these mental conditions. Now, as we talked about earlier, as we started off, healthy sleep allows our mind and body to rest and recover and recharge. So as we alluded to, the good quality sleep controls weight and keeps cravings in check. Sleep-deprived individuals will seek a higher caloric intake. This is a response to lower energy levels. The healthy sleep improves performance at school and work. This, of course, has to do a lot with our memory, and it sharpens our focus. This has been very well documented, and I would encourage listeners to seek out the book "Why We Sleep" by Dr. Matthew Walker. That he has a lot of good chapters on the importance of good quality sleep, sleep duration, sleep quality for memory consolidation and schoolwork. So that's a very good resource to seek out after the after this talk here. Now, of course, healthy sleep, it does reduce the risk for mental and physical health disorders and issues. And as I talked about earlier, it strengthens our immunity and keeps wards off colds and flus. Now, as it relates to sleep and mental health, the traditional thinking relating to sleep and mental health is that there's a one-directional relationship, that if you had a mental disorder, you would automatically, or the symptoms were, people would look at, you would sleep poorly. Now, poor sleep happened because of the mental issues. This is how people were thinking about this back in the day. It is known that people with depression, bipolar disorder, and schizophrenia, they all sleep poorly. And so, but what has been coming out now more and more to light is that there is a bidirectional. So this is the relationship between mental health, mental well-being, and sleep, meaning that poor sleep actually promotes poor mental health. So when looking at the relationship between sleep problems like insomnia and mental health, it quickly becomes clear that these problems can be mutually reinforcing. For example, there's evidence that lack of sleep can increase a person's propensity for anxiety. At the same time, being anxious, including anxious about falling asleep, may prevent someone from getting enough good quality sleep. So in this way, the problem can feed one another, and it can be much more difficult to resolve. And it is now, of course, that the poor sleep can lead to mental issues. And it's most importantly, and here comes the key, treating the sleep disorder may alleviate some of the symptoms associated with the mental health condition. So focusing on what is the actual key to the issue, it's no longer a chicken and egg type of condition. This is often a vicious cycle, and by treating the sleep disorder, it can actually help in alleviating some of these mental health concerns. Now, mental health involves cognitive thinking and harnessing one's attention to stay focused, which includes processing information, storing it in memory, and then understanding this new information. Now, during the day, we are bombarded with new information. Sleep gives the brain some downtime to process all of this information and store it in our memory banks. This way, it is available and accessible when needed. Having enough sleep improves concentration, improves creativity, and of course, as it's so important for all of us, and especially kids in school, it does assist with learning. Now, the common symptoms of mental issues that we often see is like mood swings, hallucinations, unfortunate, drug and alcohol abuse, suicidal, harmful thoughts, social isolation. And of course, by improving sleep, we can maybe lower some of the anxieties that accompany mental issues, and then really people can really dive into what the concerns are. Obviously, there may be a need for some joint therapies to go along with this, but by focusing on good quality sleep, identifying if there's an underlying sleep disorder, addressing that, it can help to alleviate some of these symptoms, as I've gotten to earlier. Now, in both the short and long term, the amount and quality of our sleep can play a huge role in our mental health, including how we feel and how we act towards other people. Even just one night of insufficient sleep can bring on stress and a tendency to become frustrated, which is not anything that's helpful in any environment. Now, continued and chronic sleep deprivation can have even more profound effects, significantly impacting a person's overall mood and potentially leading to depression and anxiety, as we have talked about. So we can look at this as a vicious cycle. That lack of sleep obviously leads to tiredness because we're not getting the amount of rest or quality of deep sleep that we require. This, of course, then can lead to, with daytime sleepiness and inattention and the lack of cognitive functioning, lead to difficulty coping with daily life. That, in turn, as we think about mental health and mental illness, can lead to a downturn in one's self-esteem. And then, of course, with that come feelings of worry and or stress. And then, of course, that stress can lead to thinking about or thoughts about, I can't fall asleep tonight. Oh, I'm worried I'm not going to be able to get the good quality sleep. And then you can't fall asleep, obviously. And then you have lack of sleep. And then you have a vicious cycle that you have a difficult time to may have a difficult time to break. And so now research has shown a stronger link between depression and insomnia, and depression can make it harder to fall asleep, obviously. And so you have that vicious cycle, but by breaking the vicious cycle, by focusing on good quality sleep, that can actually help to improve and strengthen one's resolve throughout the day, and can help to alleviate some of those symptoms of anxiety and depression. Then the second part here relates to what is our emotional health. Now, sleep deprived individual also is a positive psychological expressing our own emotions appropriately and for age and not your shoe size. Emotional health includes our thoughts, feelings, and behavior internally and externally. So our emotional health is kind of more to do with how we act and behave in and around others, whether it is at work, in social situations, and so on. But it is being attentive to our thoughts, our feelings, and our behaviors. And it also enables us to think about our ability to appropriately express how we feel, even under stress. A sleep-deprived individual will often overreact, be poor choices, word choices, or act poorly, and then but by focusing on these things, it allows us to better handle the emotional reactions of those around us as well. So it's both internally and externally. Now, maintaining positive emotional health is an active process. Emotional health front and center. As we had listed out some of the concerns that often come with mental disorders, but there are things that you can do to strengthen your emotional capacity here as well. It is identifying and building on personal strengths, realistically seeing the positive in all situations, and developing the resiliency to learn and overcome challenging situations. Obviously, resiliency has a lot to do with how we show or didn't get the amount of quality sleep that we need. Resiliency is one of the first things that, as we talked about earlier, that all that to do with cognitive functioning. So mental and emotional health, although separate, are both necessary and work together cohesively. Now, there are some areas of mental and emotional health that do overlap. Processing and reasoning are two essential parts of our personality that also carry over into mental health. A strong sense of reasoning is required to make sure we aren't losing control of our emotions or becoming unstable. Our decisions on how to react to various scenarios must also be processed very carefully to avoid anxiety and stress. Lacking a balance between processing and reasoning puts our health in an unstable state, and we may experience disorientation, have difficulty functioning efficiently. So these two things, mental and emotional health, although manage stress, we can reduce fear, anxiety, anger, and then with that, of course, feelings of depression and anxiety in the workplace. So what can we do? How do we get better quality sleep? Well, there are a couple of things that we want to point out, and this is something that we have focused a great deal on here within Sleep Charge. There is DTQ, those three letters, DTQ, the fundamentals of sleep, and sleep hygiene. Sleep hygiene is what we refer to as sleep or healthy sleep habits. So if you dive into DTQ, these are sleep duration, your sleep timing, and your sleep quality. So sleep duration, all of these aspects here, the DT and Q, you do have a great deal of say. And there are a number of things that you can do to improve on all of these aspects. Some are more easier than others, but you can have a great deal of control yourself in how to improve and ensure that your DT and Q is as it should be. Starting with sleep duration, the D. This is how long you sleep. This is your schedule. This is when you decide to turn off the lights to go to sleep, and this is when you decide to set your alarm. And what is in between is your sleep duration. Obviously, as we have mentioned earlier, 7 to 8 hours is an ideal goal to focus on for sleep duration. Obviously, with life intervening and so on, this is often where we see that things break down, in that people unfortunately do not put sleep on their schedule and stay up too late, and or take work with them to bed, or homework becomes the last thing at night, and but the alarm still has to come on at the same time every morning. So by adding an hour, for those that sleep 6 hours, by adding an hour, there will be a great deal of benefit that comes from that. But this is where you can, by putting sleep on your schedule, this is where you can really have a true impact on your sleep, overall sleep health and sleep quality. Sleep timing. Now this is when you go to sleep. Obviously, for shift workers, this is a key component. This is where we start thinking about the circadian rhythm, the circadian, our body clock. The timing of our sleep is just as important as the duration and our quality of our sleep. Unfortunately, it has been shown that by sleeping during the day, where you are sleeping against your circadian rhythm, where the body would normally, under normal circumstances, expect activity, the sleep quality is not, and the depth of sleep is not as high as during the night, when circadian rhythm is in a downward swing, where the body is expecting to get its rest. So sleeping at night, when the circadian rhythm is in its downward swing, is better than sleeping during the day when the circadian rhythm is in the upward swing. That is why it's very important for individuals that are shift workers and work third shift and sleep during the day to maximize their sleep duration, and also to maximize their sleep quality, as we get to that eventually. The circadian rhythm is our normal body clock. It is known that it is during these twice during the 24-hour period that there's an upswing, and then twice during the 24-hour period there's a downswing. The lowest point in the circadian rhythm is between 4 and 6 a.m. in the morning, and this is for those that have ever worked third shift. This is typically the hour that people find most difficult to stay awake, because that's when the circadian rhythm is in the downward swing. Then after about 7 a.m. or so, in normal circumstances, the circadian rhythm goes back into an upward swing towards noon. and then it goes back into a downward swing towards afternoon, and that's what we feel, what we call the post-lunch dip. Often there is a lack of, we feel that there is a little bit of fatigue setting in towards the latter parts of the day, or in early afternoon. That's when the circadian rhythm is back into a downward swing, and then it rises again towards in the evening, towards midnight, when it falls again. So you have those two peaks and two valleys in your 24-hour period. Knowing when you sleep and maximizing where your circadian rhythm is and sleeping in line with that has a great deal to say about getting the most out of your sleep. Then the third aspect, sleep quality. This is how well you sleep. Now, obviously, if there's physical pain, if there's physical discomfort, that's going to impact your sleep quality. You have back pain and so on. Improving, working with a physician and chiropractor and anyone to alleviate that discomfort, that will go a long way. But as we talk about sleep disorders, such as sleep apnea and restless leg syndrome and periodic limb movements in sleep, these disorders, along with all the other aspects we talked about, the arousal mechanisms and the risk for high blood pressure and diabetes, the activations or these arousals that occur during sleep, it cut away your deep restorative sleep. So you spend much more time in lighter, less restorative sleep stages, and you spend less time in the deepest, most restorative sleep stages. So even though your sleep duration may be adequate, if you have an underlying sleep disorder, such as restless leg syndrome, periodic limb movements in sleep, or sleep apnea and snoring, quality is going to suffer. So by identifying whether that is the case, and addressing those concerns, that will improve sleep quality. So there's not much you can do if you have an underlying sleep disorder, such as sleep apnea, to improve your quality, aside from just treating it. Seeking help to treat those conditions. But if there is things in the room that can, but then there are also things in the room that can diminish your sleep quality, and those relate to some of the things that we refer to as sleep hygiene. We'll get to that momentarily. But the sleep quality is really important to address, but you may need assistance from Sleep Charge or from our physicians to identify, through home sleep testing or other diagnostic procedures, to find out what is going on, and then improving the sleep quality. So what happens, of course, once we have, if you have an issue with your duration of sleep, you're sleeping too little, if you are sleeping against your circadian time, or your sleep quality is not as high as it could be, obviously there's going to be fatigue. You're going to feel that during the day, excessive daytime sleepiness and fatigue. So you have some things to look out for as signs to spot fatigue: moody and easily angered and frustrated. This is again going back to our emotional health. Taking more sick days and being tardy. Complacent and less aware of your surroundings. This comes back to the cognitive functioning, as we have talked about. Inattentive to tasks and more forgetful. This is the focus. And then stressed and struggling with demands. So again, more links there to looking at our emotional health. So if a person is sleepy or they are fatigued, fatigue is a good indicator that your sleep health and mental health are out of sync. So that would be certainly something to think about, something to seek assistance with if you or a loved one is exhibiting any of these signs. Then it's worthwhile to look into. But then there's the sleep hygiene, as we talked about short time ago, as we were talking about the sleep quality. There are so many things that you can do to improve your sleep quality. Aside, of course, if there is an underlying sleep disorder, then of course speaking with a professional about those things will come in handy. But there are a number of things that you have control over as well. First is Follow a morning and night routine. This means putting sleep on your schedule and maintaining a consistent schedule. This strengthens the circadian rhythm. It entrains the circadian rhythm in such a way that the body will recognize when it is time that it wants to go to sleep, and it will also help with, especially with maintaining a steady waking schedule, and this does include the weekends, to ensure that you have a good morning routine relating to wakefulness and being awake, and then also at night as you prepare to go to sleep. Keeping a consistent wake and sleep time, getting the recommended hours of sleep. As we mentioned here throughout the talk, 7 to 8 hours would be the recommended goal. That would be the sweet spot. And this, of course, does mean that if for someone that is a short sleeper, that it may mean, or somebody that is accustomed to do this, that sleep needs to be put on their schedule, meaning start to think about sleep earlier, trying to set their schedule in such a way that they can get to bed earlier. Exercise is a very good thing for all. Exercising daily does do wonders for our sleep. However, the one caveat that I want to point out is that exercising close to bedtime is not helpful. Although exercise may lead to fatigue, and you may then think that it would be easier for you to fall asleep, exercise elevates or increases your body temperature. And so late at night, elevated body temperature, when the circadian rhythm will be going into a downward spiral, and that thus also includes our body temperature, core body temperature. The body prefers a cooler temperature to fall asleep. An elevated body temperature just before bed will delay your sleep time, although you, as I've said, you may have more fatigue. But then also creating a sleep sanctuary, making your room in such a way that your bedroom in such a way that it is sleep promoting. This means keeping a cooler temperature in the bedroom. As I said, the body would prefers a cooler temperature around to help promote sleep. Temperatures in the 68 Fahrenheit to 72, somewhere in there, usually are closer to 68, have been shown to be more sleep promoting rather than a much warmer room. Obviously, if we have a very warm room and also a very cold room, this can lead to sleep fragmentation and then lower quality sleep. But a sweet spot for inducing sleep has been shown to be somewhere in the 68-degree Fahrenheit. Continuing with the sleep sanctuary, this also means, darker blinds, making it so that the room is such that it is free from distractions. And that, of course, means removing electronics from the bedroom. TVs, laptops, tablets, smartphones, these all can, great technologies, but ideally are not very good for our sleep, whether it is our sleep duration or the quality of our sleep. Looking into the lights of those screens, it reduces our melatonin production, and it can delay our sleep, aside from, of course, the content of what you are reading. If you're reading a very exciting book, if you're watching something that is stressful, or focusing on your work that late in the night, taking work with you to bed, if that is something, it can all be very, very stressful. So creating a sleep sanctuary in that you block out distractions, light, and make the room comfortable will go a long way to ensure you get the best quality sleep. Avoiding alcohol and caffeine before bedtime. Although alcohol has been shown that can be it's a relaxant and can help promote sleep, the quality amount of sleep will be significantly reduced. As the alcohol breaks down, the chemicals will elevate your sleep, so you don't get nearly the amount of deep sleep as you would. Caffeine, of course, is a stimulant, has a very long half-life, and can remain in the body for a long period of time. So often is, when should you have the last cup of coffee? anything, shall we say, it's difficult to kind of pinpoint, but because of the half-life of caffeine, most studies have shown that obviously not drinking coffee after 4 p.m. will help or at least will go a long way to help you not reduce sleep quality. Make time to relax, and then also to establish family schedules. So it is important for everyone in the household to be together as it relates to their sleep, because if one member of the family is so focused on their sleep, but then 3 others are up at all hours of the day, or all hours in the evening, obviously that's going to be disruptive. So, but establishing routines, we focus a lot on routines as it relates to our newborns. It's all about their sleep schedules. It is just as important for adults, and especially adolescents, to focus on having a set routine for wake time and bedtimes. So setting schedules really goes a long way to help both entrain the circadian rhythm, but make sure that sleep is on their schedule. And so that brings us to the end of the talk. We have a few minutes here to answer questions. I'd be more than happy to answer as many as we can.
Thanks, Helgi. We have a few questions that have come in. The first one is, do you recommend the use of sleeping medications to help aid in sleeping?
That's a very, very good point. Obviously, anything related to medication should be done in conjunction with a medical professional. So the way we approach it is, of course, sleep aids can be extremely helpful, especially as we are talking about breaking the vicious cycle. As with if we need to assist with someone that has, for example, insomnia, that they in conjunction with cognitive behavior therapy, for example, to temporarily where we need to kind of create whether it's sleep restriction or whether it is through a set routine of breaking the vicious cycle to try to get people to fall asleep and to lengthen their sleep time. It certainly can help. There is a place for sleeping aids. Obviously, melatonin is another one. Again, any medication use should be considered in conjunction and in consultation with a sleep specialist before embarking on any of those, even if these are medications that can be taken or purchased over the counter without a prescription. But they certainly have a place, but they need to be kind of thought of as temporary adjuncts to other therapies. For example, cognitive behavior therapy, which has been very, very helpful for insomnia, in the case where we need to break a vicious cycle. So these certainly do help with that, and so, but always in consultation with a medical professional.
Great, thank you. The next question I have is there an ideal time to go to sleep and wake up to feel your best?
Right. So as we were talking about the circadian rhythm, usually we're kind of more focused on the duration, but as we're saying, there may be with individuals some individual variances as to when their low point is. Now, there of course are sleep disorders that are circadian rhythm based, such as it may be advanced sleep phase or delayed. These are individuals where their circadian rhythm is shifted either forward, where you have people that go to bed very early and rise very early, and then others that go to bed much later, but then of course they struggle to get to work and get to school, because the school times are always so fixed. So if we just think about with an individual, we would start out with saying is, what is, an ideal sleep time? And if we've talked about 7.5 to 8 hours, obviously we have to look at when does your alarm have to go off. Obviously, if an individual's alarm has to come off at 6 and they need 8 hours of sleep, 10 would be the bedtime, and lights out, and no exceptions, no negotiations. And that would be, to answer that question, it would be ideal in that scenario, because it should fall in line with the circadian rhythm, with that there is a drop after midnight, and you'll get the most quality sleep the vast majority of the time there from midnight and on. If an individual can have a longer, doesn't have to get up at 6, still waking up at that time is helpful, because it falls within that circadian rhythm, and they would maintain a regular routine. But the more important aspect to this is, unfortunately for those individuals that are day sleepers, and where they go to bed at 7 or 8 a.m. in the morning and they sleep till 2 or 3 in the afternoon, they'll be sleeping almost entirely out of sync with their circadian rhythm. The circadian rhythm is in upward swing, and this is when the body is expecting to be in more activity. This is what has been shown, is that the amount of their deep sleep, even if they have no sleep disorders, even if they have a very good sleep environment and they are focusing on 8 hours, the depth of and the strength of their delta sleep, their deepest sleep stages, is reduced. And then on top of that, if you have a night shift worker who has an underlying sleep disorder, like sleep apnea, for example, they really are fighting battles on two fronts. And so by identifying the snoring and sleep apnea, treating it effectively, they at least have now maximized their ability to get the most quality sleep that they can, knowing that they will be still sleeping against their circadian rhythm. Okay, a good question.
Makes sense. The next question I have that's come across is, I travel for work. Do you have any recommendations on how to maintain a good sleep schedule? Should I stay on my old time, or should I try to get on the new time for where my meetings are?
Yep. That's a brilliant question. And very often this kind of just really depends on how long the trip is. If it is that you're flying over multiple time zones and it's just for one meeting, you want to be as sharp as you can for that. If it is just that one day, ideally you would stay on your schedule. Know what time it is at the location where you're going to. Know what time it is where you live, and try to maintain that same schedule, so that once you get back, it's not that much of a disruption. For longer trips, this is where you might need to think about how long you're going to stay there and how many time zones you have to travel over. This, if you have to be there for a week, then so shall we say, it would be helpful to start thinking about that a couple of weeks in advance of the trip, meaning by, especially if you're going over multiple time zone, whether it is into Europe, and especially if you go into Asia, you will need to think about how long you're there and what time it is, and so you can then begin perhaps going to bed a little bit earlier every day, or a little bit later, actually sometimes keeping you later, but you would then have to balance that with your responsibilities leading up to at your current location up to that point. Sometimes, and as it relates to this, we were talking about the sleep aids. If you do travel frequently for work, speaking about this with a physician, sometimes a sleep aid may come in handy, just to get it so that you can set yourself up for success at the site, at the location where you're going to. So I know it's a long-winded answer, but it has to do with the distance where you're going, the duration of stay. But if you do foresee a lengthy trip over multiple time zone, you might need to start planning that a few days in advance by going a bit to bed a little bit earlier every night leading up to the trip, so that you know what time it is at the location where you're going, focusing on where you are going, and then ideally you should be on that schedule if you're there for an extended period of time without having to struggle through the day. A brilliant question.
And great answer. The final question it looks like that I have here is, I've been diagnosed with sleep apnea. Is this condition treatable or curable?
Well, sleep apnea, it is a relatively common condition.